Welcome to another heartfelt episode of the Life Doula Podcast. Today, we're diving into a deeply sensitive and often unspoken topic. Is there room for passion and sexual intimacy on a cancer journey? Have you ever wondered how love and desire can persist in the face of adversity? How do couples maintain physical and emotional connections when battling the profound challenges of cancer? Joining me today is someone I just met, but someone who holds deep insights into these questions. Dr. Maricar Sabeniano, a young, compassionate family doctor and palliative care specialist who has dedicated her career to supporting patients and families through their most vulnerable times. Dr. Sabeniano, welcome to the Life Doula Podcast. Masyada akong formal, Doktora.
Thank you, Miss Charity. Salamat. Kinabahan ako sa formal.
We're honored to have you here and excited to explore this conversation.
Yes.
Alam mo yan, I was very upfront with you na this was the most sought after talk. Not that the other talks were not appreciated, but this was the first time we ever had a talk on this, and now a more lengthy discussion on this topic.
Thanks, Sister. Actually, it was also my first time giving this talk. It's not usually asked for, and I was surprised that finally somebody wants to talk about this. I'm glad we're having a longer conversation.
Thank you, Doctora. But just for the sake of our audience, can we just define the specialty of family medicine as opposed to the other specializations of doctors?
Right, so family medicine, as a specialty, we take care of all patients from what we call it is from womb to tomb. We do handle a variety of cases from wellness to chronic illness to serious illness. And within that specialty, our subspecialty is palliative medicine. I am a palliative specialist, and palliative specialists focus on quality of life for those patients and families who are facing chronic, life-limiting, life-threatening, or serious illnesses. So a lot of our patients would be cancer patients, other patients, COPD, CKD.
Chronic diseases.
Chronic
right?
diseases, yeah.
Okay.
We make sure that they have quality of life,
Yes.
that their needs are met and that the family's needs are also met.
Doctora, what are the common myths around sexual intimacy during the cancer journey, and how do they differ from the reality that patients often experience?
The most common myth, I'm sure you've encountered it as well, is that cancer patients don't have the room to think about or need sexual intimacy.
My God.
Yes, right? It is a myth. In reality, well, there are patients who might not value that part of their physicality or psychosocial aspect much. But for a vast majority, I've had several patients as well who value having physical connections. But more than that, I think all patients would still want intimacy.
Yes.
Even more so during a serious illness journey, a cancer journey.
The myth also that I want to clarify with you is that when you're under treatment, you
can't.
can contaminate your partner with the medicines that you take.
Right. So this needs a little bit more of a tailored approach. Depending on the types of treatment, chemotherapy, radiation therapy, there might need to be adjustments on how physical intimacy, sexual intercourse is played out, is experienced. There might be needs for some barrier protection, condoms, maybe during radiation, depending on what your oncologist and radiation oncologist would advise. There might be a need for a period lang, not the entirety, a period of abstinence, right? So yes, there might be some risk, but it's not a risk that cannot be controlled, right? Or managed, yes. So physical intimacy, sexual intercourse, or connections of this kind can still take place. We just need to adjust a little, and make sure to talk about it with your doctors because it depends on the treatment you're receiving.
There's a big reason why people should talk about it.
You're right.
When you
Yes.
said it should be tailored fit, then it really calls for an open conversation.
It does.
With your attending physician.
Yes, especially since we talked about this during the summit. I told you guys there are evidence to show that maybe 30 to 50% people who have undergone cancer treatment up to survivorship who will still have long-term effects on their sexual capacity from the treatment or the illness, which would mean it's a long-term thing that would need continued
Guidance.
care.
Yeah.
And guidance. Yeah, so it is very important for us to talk about it.
Wow. How can couples maintain that emotional connection and passion during the cancer journey?
The cancer journey on its own is already very challenging. Maintaining connections physically, emotionally should not be the most challenging thing because they need to have an understanding. We need to be able to share with these patients, with these people and their families. They are still people, no?
They need affection.
They need affection. They need to be touched. They are beautiful, handsome. They are still who they used to be. What's the quote, Ms. Charity? No? Cancer has, I have cancer, but cancer does not have me.
Yeah.
Physical connection, you've had it before. And if the question is, how do we navigate this? If you know your body, you also know the areas of your body that are important to you, that are your on and off switches.
Yes.
On and off switches, meaning your erogenous zones and your turn off zones, right? For example, if you're a breast cancer patient, then definitely if you're undergoing still your treatment or going through survivorship, or maybe you've had that surgery and didn't do reconstruction or whatever, maybe that spot isn't your erogenous zone anymore. Might still be, I'm not sure. It depends on who you are, no? Like, breast or no breast, touch it there, that's fine.
Yeah.
But isn't your neck an erogenous zone? Aren't your lips an erogenous zone? Your fingers, your brazo, your thighs, all of these. Your stomach is an erogenous zone. To be honest, anywhere there's skin is an erogenous zone.
Yes.
Right? And all of these are ways to provide physical connections, physical contact, and beyond that, more than just the physical connection is the emotional intimacy. Even people who have sexual encounters that are non-physical, you might have heard of texting, chatting, phone calls.
Don't you love her?
Yeah, a phone call. Like, all of these work, right? These are sexual encounters. These do allow us to express our sexuality and still receive satisfaction.
True.
So actually, satisfaction from relationships is not just a physical experience. It is a mental, psychological experience. It is the experience of knowing that your body is appreciated and that it's important, and it's a feeling of I am sexy, I am worthy, praise me.
Yes.
Yes.
One of the things that I learned from Dr. Sabeniano during the Cancer Thrivers Summit, and I got this wrong, right? She did a very good way of introducing this topic via Q&A or a trivia. And I think one of the questions you asked, and I answered it the wrong way, is orgasm
Necessary.
the only way, the end point of satisfaction? And I said, yes. And Doctora said, no. Orgasm is not the gauge of satisfaction.
Yes,
Do you
yes.
mind elaborating on that, Doctora?
Right. Well, congratulations to everyone who has experienced an orgasm. It's not, but it's not, no. During the summit, the example I gave was the first kiss, but unfortunately, some people were not satisfied with their first kiss.
Yeah.
But even simply holding hands with someone you love, the first kilig, that is so satisfying. And the first kiss is something that people dream about. Hindi ka makatulog, na-kiss ka na finally.
Yeah.
That's satisfaction right there.
Wow.
Diba? Simply getting to the point of desire and arousal could already be satisfying. Syempre, kung nabitin, go ahead.
Yeah,
right?
continue.
Continue for all means and by all means and purposes. But not all sexual encounters end with orgasm. But they can still be satisfying because nga, it's not just a physical experience.
That's
Yeah.
a very, good statement and really putting it in perspective. Doctora, what role does communication play in sustaining sexual intimacy during the cancer journey? And how do you think couples could improve in this aspect?
So communication is the foundation of any sexual intimacy. Because we put the words together, and we should, no? It's not just a sexual encounter. It's not just a physical act that's taking place. It's intimacy, sexual intimacy, which means a relationship is going on and a connection has taken place. That's not gonna happen if there was no communication. Simply because you and your partner cannot know what is good for you and what is good for me if we don't talk about it. Especially during a cancer journey, your body starts to kind of change a little bit, right? Or maybe a lot, which means you need to rediscover your body, what is okay to be touched, what is okay to be held, what is okay to be talked about,
Yeah.
right? And what is not okay. I don't want to be touched there. I don't want you right now to talk about my hair, something like that.
Yeah.
But you need to talk about it because otherwise, it might just actually bring conflict and distance that intimacy.
Yeah.
Because not talking about it also means your needs will not be known. Again, there's only one person who knows what you need, and that's you.
Yeah.
And if you're not able to communicate it, say it out loud, no one else is gonna know.
Yeah.
Right? We can't
Especially your partner.
especially your partner. There are very, very good relationships, no? Na your partner seems to know how to read your mind, yung ganun na feeling. But a serious illness diagnosis, a cancer diagnosis, can actually change how you think, how you act, and sometimes you might think na parang wala nakaintindi sa akin. It might just be a lack of communication.
Yeah.
And how to start it is kind of, if we're talking about sexual intimacy, maybe start out with non-sexual intimacy topics. Yes, non-sexual intimacy topics. How are you doing now? How do you feel about the diagnosis? Or how do you feel about your breakfast? Or talk about something non-sexual first and kind of go into that discussion slowly. Well, how do you like to be touched? Is it okay for me to hold your hand?
Yeah.
Right? And when you go there, we used to have more physical contact.
Yeah.
How about now? Is it
Are
still
you still
okay?
okay?
Yeah,
Yeah.
is it still okay? Or is it still something that you'd like to talk about at all, right? And if they say yes, and definitely that's something you need to talk about. If they say,
Sure.
not right now, I'm a bit busy vomiting, right?
Yeah.
Then, okay.
Hold it.
Yeah, hold it. All right, okay. But in case you want to start talking about it, we can.
Yeah.
Right?
Yeah.
And the patient as well, no? If it's you who really needs to talk about it, open up. To be honest, you really need to understand that the people around you,
Do not also know.
yes, don't know, but also want to help.
Yes.
Yeah, that's why
Very
they're
important.
there. Yeah.
Very
that's
important.
Yes, they want to help. The best way for them to help is for them to know what's most important to you.
Yeah. So I think we've established that physical intimacy has room in the cancer journey, right? And Doctora, what truths around sexual intimacy during cancer treatment do you think are most important to patients and even to their love givers to understand?
Some truths are that connection is important. If we don't have connection, we forget who we are, no? We lose a source of support.
Yes.
And sexual intimacy is really about, I was telling you this earlier, The reason this is so important is because it's talking about self-worth, right? How you view yourself, how you view your body, and what track you are already on in your cancer journey.
Yeah.
Once they start talking about intimacy, then I know that this patient or this person has already gone beyond the fear
Yeah.
of their cancer, has conquered already hesitations about who they are, and has now started valuing their body for what it is and wants to rediscover how to use this body in the way that they would like, and to demand what they need. I love that. I love it when
I
they're
love
at
the
that point.
rediscover and demand.
Yes,
right?
kasi nagtanong na eh.
Yes,
Nagtanong
that's
na.
true.
Nagtanong na, how do I still maintain my sexual life? Oh, well, I'm glad you asked, right?
Right,
Yeah.
right. And again, to our point, all the more reason we gotta talk about this.
Yeah.
And I wish this is part of the prehabilitation of cancer patients, right? That, hey, you can still, again, tailored fit to the case, right? You can still go through all of these things that you enjoyed before. Because really the misconception is everything stops when you're undergoing treatment, which is not true.
Yes.
Right? I
That's
mean,
true.
I cannot recall a patient saying, I went to my oncologist to discuss about my sexual life.
Yeah.
Parang it's almost not discussed, as if it's a taboo.
Yes.
Yes, that's why we're having this conversation. Doctora, what are the risks? Because people talk a lot about, oh, there are risks when you make love. There are risks when you kiss each other. Eto pa, after your PET scan, you cannot, kiss your partner.
Okay.
So are these things true? Are these really valid risks?
Oh, it was my first time hearing about the PET scan. So it's like a bit much. Right. So if you're concerned about radiation risk, this is something that you need to talk about with your radiation oncologist, especially since, the level of radiation that treatment requires is different for each person. There might be a need to kind of have a period of abstinence. Not
Period
meaning,
lang naman.
period lang naman. Hindi naman like parang, okay,
Forever.
na-radiate ka na. Wala na.
Hindi na.
Dok, paano? Right? So, hindi naman. For chemotherapy, the white, in general, what would probably be needed is barrier contraception while you're on still treatment, meaning a condom, or I mentioned during the summit, like a dental dam. A dental dam is something like a condom, except like, in the dentist, you open your mouth and then there's a sheath on it. So para pwede pa rin magkaroon ng oral intercourse but still protected against any transfer of chemicals that may still be there in the body.
Can we just go back a little bit to the question? For full transparency, patients sent me questions for Dr. Sabeniano. Not that I'm washing off my hands, but these are questions from patients. They hear a lot that when they go through PET scan, because naman there's radioactive dye, right, that you infuse on the patient. Is it true that they cannot kiss or have physical intimacy with their partners?
Kiss, probably no. But yung sexual intercourse, a period of abstinence, like a few days or a week lang naman yan siya kasi PET scan lang naman. It's not like continuous radiation treatment.
Yeah.
But in the general picture, probably not. No sexual intimacy, no. Even if you're going radiation therapy na nga, it's not a no. It's just a wait. Right? Wait lang.
I just want to underline that. It's just a wait. It's not a complete no.
Yes.
Which means timing is important, right?
Right. Yes. And it's a wait for physical connection, but it's always a go for emotional connection. Yeah.
Pwede pa ring hug, cuddle.
Yes. Pwede hug, pwede cuddle, hold the hand, date.
Yes.
Yeah. Have a steak night. Or if you really want, like, doc, I know I'm past the dating phase. What we really want is the actual physical contact. If you're telling me to abstain for now, how do I satisfy that? Again, remember, words matter, right? Use your words. Texting, calls, chatting have all worked, even for those who don't have illness.
Yes.
It will still work even when you're on physical abstinence.
Which means you gotta be creative.
Be very creative.
I love
Which
that.
is more exciting, no?
Yes,
It's
yes.
actually more exciting.
You get to innovate and explore.
Yes.
So see, you can keep the passion going.
Yes.
You just have to find.
I like to think of it as once you're in that phase already of being ready to talk about it, you might actually elevate your sexual intimacy because now you find out new avenues, new ways.
You're giving our audience a lot of things to think about.
Yes, looks like they're very interested. So be interested. That's your body.
Yes, of course. Doctora, since the people during the summit was very transparent that not a lot of healthcare providers are quite supportive in this area, and we don't know the reason. It could be lack of time. How can healthcare providers support conversations around intimacy and relationships for people living with cancer or those on active treatment, especially?
Yeah, we're here to support patients. Like I told Miss Charity, we're not taking off a breast, we're not taking off a liver, we're not taking care of a pancreas, we're taking care of a person. And people have needs, and those needs are actually part of guidelines, right? Evidence-based guidelines in wherever you search the internet, and you're gonna see good quality publications on sexuality and cancer care. So we need to stay informed. These are even in our textbooks, our Bibles.
Really?
Yeah, sure. Cancer care, palliative care, it's there. Don't skip the chapter, right? Because it's important. It's even part of the screening tools. It's not just asking about pain, breathlessness, nausea, vomiting, sleep, appetite. Within that list is sexuality.
Really?
And if it is not asked, this is always the, what do you call it?
The caveat.
Yeah, if you don't ask it, no one's going to answer.
Yeah.
And if you don't ask a question, no one's going to answer. And your patient, if you didn't ask it, she's going to think, or he's going to think, well, I guess it's not important.
Yeah, because
right?
it was not discussed.
Yeah.
So I think that was the message of Doctora to healthcare providers. Now, this is my message to our patients. If you need to know about something, ask.
Yes.
If this is not discussed during your treatment plan because you feel it falls outside of the treatment plan, ask. Yeah. My position has always been, if you don't ask, the default answer is no.
Yeah.
Right? Mm-hmm. So, patients ask. It's not a question that's not important. As Dr. Sabeniano said, if it's important to you,
yes,
then it should be important to your doctor.
Yes.
Right? Doctora, for those that are newly diagnosed with cancer and is concerned about the impact of treatment to their intimate life, you've said a lot about it. But normally, newly diagnosed patients are very, very careful.
Yeah.
Right?
Of course.
What would you advise them to do at this point? Na parang they're still thinking of so many things.
Yes. For newly diagnosed patients, sexuality, your sexual intimacy might probably be the very last thing on your mind. You're still grappling with a new diagnosis and you're still in the impact phase, right?
Yeah.
But always consider that your life will continue and your life is important. You have a diagnosis, but that's not your life, right?
That could be a chapter of your life.
It is a chapter of your life, but your life will continue beyond it and despite it, right? Which means when you start talking about treatment, you need to be able to talk to your healthcare provider in terms of how will this impact my sexuality. If you're in your childbearing years and you still want to have children, you'd want to ask, how will this impact my chance to
Get
procreate,
pregnant. Yeah.
yes, in the future? And if this will impact my libido,
Yeah.
my erectile function, is it
For
long lasting?
males.
Yes,
Yeah.
for males. Is it long lasting? Is it something that we can still manage later on? Because then your doctor will know, oh, this is important to you, of course, right? It should be important to everyone because it's something you will need to live with forever, right?
Yes. Yes.
So your diagnosis is something that we'll handle now, but your life going forward is something that you need to be able to consider even before treatment starts,
Yeah.
so that you can choose wisely.
Yeah.
Yes.
Yeah. We've been talking about intimacy from the perspective of the person living with cancer. Let's shift the angle a little bit and look at it from the lens of the love
family.
giver.
Yeah.
Say, for example, the patient is the wife and the love giver, of course, is the husband. What would you advise the love giver in terms of communicating their needs as well?
Yes. Well, first, your needs are valid as well.
Yes.
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 You are also in this journey. Yes.
Correct.
Yes. But also, too, be a little sensitive.
Yeah.
Yeah, you're part of the journey, but she's receiving the treatment or he's receiving the treatment. So be sensitive. Make sure the timing is right, meaning it's okay to talk, right? How do I know? Ask. Is
Yeah.
it okay to talk about what? Our physical intimacy,
Yeah.
right? But then that sets the stage,
Yeah.
right?
Because even normal couples should talk about it.
Yeah, I know.
Right?
Yeah,
Right?
Right. So, it sets the stage, and then, well, what about our physical intimacy? Wag naman diretso sabihin yun na kasi hindi na ako nasa-satisfy. Wala
Yeah.
naman, hindi naman
Yeah.
kailangan ganun. It doesn't have to be that way. You can say, well, there are needs that I'd like met, and I was wondering if you're still open to talking about it right now.
Yeah.
And if she says no, or he says no, then that means stop the conversation and
Try another
try
time.
another to ask. We'll just leave the door open. When you're ready, can we talk about it? But if they say, yeah, I think I'm ready to talk about that with you, then you can start rediscovering your relationship and what the do's and don'ts are, what the on and off switches are.
Yeah.
Right? If you feel like, Doc, I don't think we're at a good place to start that conversation immediately, date her, date him,
Wow.
right?
Yeah.
Ligawan niyo po ulit. Do the courtship phase again, because during courtship phase, we were all never ready to have that conversation yet.
Yes. Rediscover each other.
Yes, rediscover each other, rediscover and rebuild your relationship. Because if that conversation is not yet ready, physical intimacy is not yet ready, you can build on the emotional intimacy first.
Yes. Very good tip for both the person living with cancer and the love giver. Right? Doctora, I have had patients. Cancer really changed their marriage and their relationship. And to be very, very blunt, there's so many cases of the couple splitting up during the cancer journey. And if you dig deeper, one of the biggest cause was the lack of intimacy.
Yeah.
So can you tell our audience again how important and how wide the scope of intimacy is in the cancer journey?
Intimacy, again, is not just about physical contact kasi. Intimacy is about emotional connections as well. There's the physical side and there's the emotional side. And as much as physical intimacy is important, it might not be sustainable all throughout, right? It will waver up and down depending on the course of the treatment, on the illness effects itself. Sometimes you're a little bit tired today.
And the physical pains.
Yes, and the pains, right? So throughout your journey, your physical connection might go up and down. But the emotional connection, the emotional intimacy should be the most important thing. The connection between you and your partner should never waver, simply because you're actually the support, no? And taking away that support is has such a big impact. We've seen this in our patients,
Yes,
right?
yes.
It's devastating. It's devastating to have support withdrawn from you, especially if it's your partner. That's the number one person you were going to. So emotional connection is the most important thing during cancer journey, and physical intimacy may play a part, may not play a part,
Yeah.
depending on the timing and the need. So intimacy is a broad spectrum of connection between the partner and the patient throughout the cancer journey and even after during survivorship, which we hope as care providers
Yeah.
to maintain and strengthen. So if you feel like you're a patient or a partner who's feeling a little bit rocky, who's feeling like, well, it's easy to say that, doc, but I'm starting to feel the burden and the strain. uh, don't make drastic decisions, right? Don't make drastic decisions. Talk to someone. Talk to the healthcare provider, talk to our coaches, talk to our counselors. There are people who can help,
Yes.
right? We're not giving up, so you don't give up
Yeah,
also.
that's good. And this actually strengthens our point that in the cancer journey, no one doctor can really take care of you.
Yes.
It's actually a team
Yes,
of both
yes.
medical professionals and even counselors,
Yes.
right? Who may be able to help you hurdle the different challenges that you are going through.
Right.
Doktora, phone in question to. Patients whose cycle is disrupted by chemotherapy, where menopause is induced by chemotherapy. And so therefore, a lot of things go on.
Yes.
Lubrication
Yes.
doesn't happen. Dryness happens a
Yes.
lot. And so therefore, even if both partners agree to have physical contact, it's painful,
Yes.
physically painful for the woman.
Yes.
What would your advice be? What can mitigate? What can help?
Thanks. Right. That is a common problem. Vaginal dryness, because maybe surgical menopause, temporary menopause, or the chemo hormones kind of got off, right? So, vaginal dryness, which would cause pain during penetrative sex. Um, these can be addressed by lubricants. There are a lot on the market.
There are lubricants in the Philippines.
Yeah, you go to your Mercury drugstore, you don't even need to bulong it. It's right there in the counter. It says there. Well, I won't say brands. It says lubricant right there, right?
Is it safe to use this?
Yeah, so water-based lubricants are safe to use. You can put them on the penis or intravaginally as well, no? No problem. The amount that you'll need depends, because if you put too much, too slippery.
Yeah.
If you put too little, still painful. How do I know, doc? You need to start using it so
Yeah.
that you know,
Yeah.
right?
So parang gamot, you adjust the dosage. Ganun ba, Doc?
Parang ganun, pero mas masaya.
Oh my God. That's good.
And I think somebody asked about lidocaine.
Yeah.
Right? Lidocaine, there are topical lidocaines, like yung EMLA. I hope no one is able to buy it over the counter.
Yeah.
Yeah.
That's a big question mark if you have access to it.
Yes. But if someone does buy it over the counter, please don't use it without the recommendation of your healthcare provider.
Yes.
And it's not something you can put inside, right?
Yeah.
So the pain inside might be due to dryness, right?
Yeah.
But if there are sensitive parts in your body that you'd like to be touched, it's a bit painful, that might help. But please see your doctor first.
Yeah, my disclaimer is always, when you use something like medication,
Yes.
always ask your doctor before
Right.
using it. Never self-medicate.
Yes.
Right? That's gonna be very consistent all the time. The other phone in question, Doctora, is we have patients in the center, survivors, who have had reproductive cancer.
Yeah.
Uterine, ovarian, right? And
Cervical.
sadly, it happens to very young patients in their 20s. What are options for them if they're diagnosed with this, either cervical, ovarian, which will somehow compromise their ability to have babies, what would you advise them upon diagnosis? What questions or what should they consider?
Right. So for those patients with reproductive gynecologic cancers or malignancies, this is a very good conversation to have with your oncologist or healthcare provider, especially if you're someone who still wants or is considering childbearing in the future. Treatments, surgery may impact that ability. And please know that even if treatment is needed immediately, sometimes that's the case, right? And you have not yet had children but would still want, there are still options, meaning adoption is always one.
Yeah.
No? I'm not sure, depending kasi sa patient. Maybe getting your eggs harvested would be another, depending nga sa tao at sa
Values,
cancer,
yeah.
sa values, no? But progeny, children, are a matter of the heart,
Yeah.
not just of blood and body and DNA.
Yeah.
And the most important thing is that you will continue to be able to provide them with the upbringing and care that they need. It's a very difficult topic. Yes, because then you need to choose over. It feels like you're choosing between yourself and the life you want.
Yeah.
But we are resilient, and you can still have a new life, possibly a better life.
Yeah.
No? And this is the story that you will be able to continue.
And you will rewrite it with
Yes.
with God, right?
Yes,
What your
yes.
story will be.
Yes.
Doctor, these are real life examples, like people with ovarian cancer, they will choose to preserve their ovaries.
Yeah.
And I have seen patients who at the very end will still choose that opportunity to have a baby, even if it compromises
Yeah.
their health, right?
Yeah.
So let's now talk again to the love givers, the husbands. How can they best support their wives who are so adamant to do it out of love, to still keep ovaries
Yes.
and other parts of the body that will help in the procreation?
Yeah.
What would you now advise the love givers?
For their partners, their love givers, their family, to be, I'll shoot point blank. There's only one person who owns that body. And there's only one person who should be able to decide.
Parang naiyak ako dun.
Right? If we take away someone's ability to decide for themselves, that's a terrible, terrible thing to do. That was already a very difficult decision to make in the first place.
Yes.
Right? Choosing to maintain versus other options, that was already a very difficult decision to make on their own. And our role now is to respect decisions, respect dignity, and to ensure that whatever that wish was, let's try to get it to reality, right? Because that was a choice. If we break that choice, we're breaking a person.
Yeah. And this is really the core of palliative care and a patient-centric way of taking care of the patient, which means we consider the person behind the diagnosis. As Dr. Sabeniano said, you are not just looking at the liver with a tumor or a breast with a tumor. You are taking care of a whole person. And so how you have to take that whole person as she is or as he is, right? Doctor, you have one of the things I loved about the way you conducted your talk was the truth and the myth portion, right? Is this a myth or a truth? Binaliktad ko. Si
Ako
Doktora
na
yung tinanong ko.
sasagot. Oo. Sana alam ko yung sagot.
That, I'm sure you know the answer. That cervical cancer is caused largely by sexually transmitted disease.
Very.
People always say that HPV is sexually transmitted. Is it a truth or a myth?
Right, so sexual intercourse can increase your risk for HPV infection or cervical cancer, which is why screening
Yes.
should be based on the first sexual intercourse if you haven't yet reached the age of first screening, right? So it does increase, but that doesn't mean we stop, right?
Yeah,
Because
yeah.
also, happy to report,
Yeah.
it is one of the vaccine preventable cancers.
Correct.
And vaccination is available, which is why the goal is to get, well, the WHO goal, right? The initiative is 90, 70, 90, 90% vaccinated, 70% screened,
Yeah.
90% of those who did screen positive to get treated.
Yeah.
Right. So, vaccine preventable po. That doesn't hinder you from having sexual intercourse. But if you have already had sexual intercourse, you would also want to start getting screening.
Yeah.
Yes.
And screening could mean pap smear?
Pap smear, visual acetic acid, inspection by acetic acid. Both will require you to lie down and open your legs. The pap smear is like a brush that's put into your cervix and they look at it under the microscope. The visual inspection with acetic acid, they suka, vinegar, put it against the cervix, wait a few minutes, see if it changes, and that would already give us an idea if you need further testing. There is also HPV DNA testing. But the first two are the easiest, readily available, and even I know midwives in our local health centers are already trained to do, right?
What about the HPV vaccine? How early can women take it?
Right. So it's actually recommended even in teenagers.
Okay.
Yes. As early as 9 years old. Pwede
Wow.
na.
Pwede na.
That is actually the goal. Yung 90% is yung teens. Na
Nine,
sana
9 years old and above?
9 years old to 21 ang recommended. 26, 21, 26.
So kaya pa hanggang 26 years old. But ideally, before you have any sexual activity,
Yes, before you have
dapat
any.
yun muna.
Yes.
At pag nakalampas na sa sexual activity, then screening. Be very vigilant with the
Yes.
screening.
Vaccination would still be something you'd want to do
Before
even,
you turn 26.
yeah, even if you've had already sexual intercourse.
Okay. And HPV vaccine is readily available in the country, right?
Yes, it's available in the country. Hopefully, magkaroon na, well, nagsistart na mag-roll out din ng DOH. It's also a
Wow.
DOH initiative to get cervical cancer control into the system, right? Private sector-wise, it is something you can purchase and have a nurse or a doctor a doctor inject for you.
Wow. I made sure when I was done with my cancer treatment that my daughter immediately, get
Got
the
vaccine,
vaccination.
yes.
I think she was 16 when she had it.
Good.
So, Doctora, we've covered so many things and I'm really grateful for that. But I still go back to what I told you earlier, that the stigma is still around. And you told me na you thought na we're over the hump. The stigma of discussing sexual intimacy in cancer care is still very, very prevalent, right? What would you now advise our audience before we close on how to reduce the stigma? How can the patient, the love givers, and even the healthcare providers reduce the stigma so we can also enhance patient care?
Right. So the reason we keep mentioning myths versus facts and truths is because we need to break the myth. We need to stop this mindset that talking about sex is taboo. It's bad. Green-minded yan, masama yan. It's not. It's part of who you are. It's part of who you were born. You're born with it. It's how you dress, how you talk, ba? How you project yourself. That's your sexuality. It should not be a taboo topic. It's not true. So let's break that myth na. Finish na dapat yun na. It's not true that cancer patients do not have room for sexual intimacy or that it is not needed in their lives. It's not true. Break that myth. Break that myth that sexual intimacy is dangerous during cancer treatment. It's also not true at all. And also break that myth that satisfaction and happiness with physical and sexual intimacy is reliant and dependent on penetrative sex or orgasm. That's not true. Hold each other's hands. Above and beyond that, know that your needs are important. If this is something that is valuable to you, please talk to your care providers. If they dismiss you, please talk to another care provider. Not meaning abandon your doctor, no? But there are people who are ready to help, right?
Yes.
Yes, and we do want to help. Why? Because we want you to have a good quality of life. You are important. Your life is important. And if this is important to you, then it is important to us.
As what they always say, you matter because you are, right?
Yes.
Doctora, where can our patients find you? How can they reach you? I'm sure they get very interested and excited with the things that we talk about. But I just want to say that Doctora Sabeniano is a family medicine doctor and a palliative care doctor. I made a joke during the summit. I said, Doctora, are you this generation's Doctora Holmes? Sabi niya, no naman. But she's the first person who said yes to this topic for Better Days and for our Cancer Thriver Summit. So, Doctora, we are so grateful. Where can they reach you, Doctora?
Great. Thank you. Again, I'm not a sex guru. I wish. I'm
Yes.
sure. But
That could be an opportunity.
I'm not yet sure. Yes, but no, I am very, very much advocating for you to be able to live your life the best way possible. I am with Healthway Cancer Care Hospital, with Manila Doctors Hospital, and with the Philippine General Hospital. And also, I'm here representing the Philippine Cancer Society. Contact me anywhere and we'll be ready to help.
Doctora Sabeniano responds to Facebook Messenger.
Yeah.
There probably may be a delay, but she always answers,
Oh, yeah.
right? And she has mentioned Healthway Cancer Care Hospital. This is the first cancer care hospital in the country. It's
Yes.
in Taguig,
Yes.
Arca South. She is with PGH. She is with
Manila Doctors.
Manila Doctors. So, and do you do online consult, Doctora?
Yes, just go through Manila Doctors team or Healthway Cancer Care Hospital team.
Okay. So there you go. She is accessible. And if you have communities and you want to invite her, just give her ample time because her schedule is also busy. And I'm really grateful that she said yes to this. So as we wrap up this insightful episode of the Life Doula Podcast, I really want to thank Dr. Maricar Sabeniano for sharing her invaluable expertise and insights with us today, navigating the intersection of passion, intimacy, and a cancer is complex, but it's a journey that many face with courage and resilience. So, Doctora, I have learned a couple of things. Number one, open communication is very important. Remember that open and honest communication with your partner is essential. It's necessary to express, according to Doctora, the needs, the fears, and desires to maintain a connection and navigate the emotional and physical challenges of the cancer journey. Number two, yung mga totoo at hindi totoo, myths. Be aware of what's not true surrounding the intimacy during the cancer treatment. Challenging this myth by asking doctors. As Doctora said, if your attending physician is not open, find another doctor who can answer. It doesn't mean you abandon your attending.
Yes.
Maybe she or he is not open. There are other doctors like Dr. Sabeniano who's open to discussing this. So, challenging misconception allows for a broader understanding and acceptance of your individual experience. Highlighting the truth that intimacy can still thrive in unique, creative, and meaningful ways. Number three, seek support. Don't hesitate, as Doctora said, to seek support from your healthcare providers and other doctors, counselors, or support groups. Their guidance can be instrumental in helping navigate the sensitive aspects of your journey and ensuring that you and your partner feel supported. So thank you for joining us today and taking part in this very vital but rare conversation. We hope you found these insights helpful and that they empower you to explore and redefine intimacy within your personal journey. Until next time, stay connected to the passion and love that life has to offer.